Special Population presentation by Brianka Larkin. Childhood and adolescence are critical stages of life for mental health. Children and adolescents acquire cognitive and social emotional skills that shape their future mental health and are important for assuming adult roles in society. Nearly 1 in 5 kids in the United States have a mental, emotional, or behavior disorder. Many adults with mental disorders had symptoms in childhood and adolescence that were not acknowledged or addressed. The earlier treatments begun for a young individual with symptoms of a mental disorder, the more effective it can be. Early interventions can help avoid more serious long term problems as children grow. Being mentally strong during childhood involves accomplishing developmental and emotional milestones, as well as learning good social skills and how to deal with problems. Children who are mentally healthy have a higher quality of life and can perform well at home, school, and in their communities. Mental disorders in children are defined as significant changes in how children usually learn, behave, or manage their emotions, resulting in distress and difficulties getting through the day. Many toddlers experience occasional fears and worries as well as disruptive behaviors. If the child's symptoms are severe and persistent, interfering with school, home, or play activity, he or she may be diagnosed with a mental illness. Behavior problems, anxiety, depression, autism are some of mental disorders or behavior issues. The total economic burden of mental disorders in kids and adolescents was 191 billion. The direct burden was 565 million and would have increased to 49 billion if all patients had sought professional therapy. Mental disorders in children and adolescents have led to considerably economic burden for both individuals and society. More effective prevention measures and more preventative policies should be adopted to cut down economic burdens caused by mental disorders in kids and adolescents. The DSM-5 is another assessment used to diagnose mental health disorders. It consists of 17 or 35 question versions, which checks for behavior and attention issues in ages 4 through 16 years of age. The SDQ is a 25 question screen done for problems with attention, anxiety, depressions from ages 2 to 17. There are numerous tests that can be used to diagnose children with mental health disorders, such as the Patient Health Questionnaire that can be used for screening for depression, anxiety, and panic attack. The PHQ offers multiple questionnaires that range from 2 to 83 questions. A longer version addresses mood problems, anxiety, eating problems, alcohol use. Childhood mental health illness are treatable and manageable. Based on the best and most recent medical evidence, there are numerous treatment choices. Everyone engaged in the child treatment includes parents and doctors should collaborate closely. It is critical to address the requirements of adolescents suffering from mental illnesses. Adolescents' mental health depends on avoiding being institutionalized and over medicated. Prioritizing non pharmacological approaches and respecting children's rights in accordance with the United Nations Convention on the Rights of the Child and other human rights documents. The treatment usually consists of medication and therapy. Medication can be a useful component of treatment for a variety of childhood and adolescent psych disorders. Psychiatric medication should be used in conjunction with a complete treatment plan that includes ongoing medical evaluation and, in most cases, individual or family psychotherapy. Up to 20% of women are affected by mental illness either during pregnancy or in the 12 months after giving birth. These can include anxiety, depression, postpartum psychosis and post-traumatic stress disorder resulting from birth trauma or caring for an ill baby. A large-scale research study published in 14 showed that mothers who planned to breastfeed and who actually went on to breastfeed were around 50% less likely to become depressed than mothers who had not planned to and who did not breastfeed. Mothers who planned to breastfeed but who did not on to breastfeed were over twice as likely to become depressed as mothers who had not planned to and who did not breastfeed. The Yale School of Medicine study found that the cost of breastfeeding for a year can range from $7,940 to $10,585. For low-income families, this would be a huge barrier. Around 17.5% of children under 5 years of age limit live under the poverty limit. That suggests that almost 1 in 5 kids are living in households where breastfeeding would take up over half of the family's yearly income. Comprehensive assessment includes discussing with the patient about their current mental health. Signs include crying often and not always for a reason, feeling very tired, having trouble falling asleep, having trouble staying asleep, having trouble thinking clearly, or feeling out of touch, feeling very nervous around the baby, becoming easily annoyed and or angry and not understanding why, feeling that nothing will ever be the same and not feeling like yourself. The use of the PHQ-9 or the Edinburgh Postpartum Depression Scale. Both of these screening tools are free, widely used, and are validated for use in the perinatal period, which we define as pregnancy through the first year of a child's life. The PHQ-9 is a multi-purpose instrument for screening, diagnosing, monitoring, and measuring the severity of the depression. Treatment for perinatal depression often includes therapy, medication, or a combination of the two. Several types of psychotherapy can help women with perinatal depression. Two examples of evidence-based approaches that have been used to treat perinatal depression include cognitive behavioral therapy and interpersonal therapy. CBT is a type of psychotherapy that can help people with depression and anxiety. IPT is an evidence-based therapy that has been used to treat depression, including perinatal depression. Also, social support, medication, balanced nutrition, exercise, and sleep. The LGBTQ plus community extends to encompass all variety of people with different gender experiences, sexuality, and psychological sex characteristics. The LGBTQ plus population has disproportionately increased in mental behavior and substance use health disparities. Compared to their counterparts, this population faces challenges and barriers that contribute to their access to health care. Health disparities such as suicide, self-harm, depression, violence, sexual assault, and harassment are disproportionately higher in this population. However, access and inclusion of these minorities are still proven to be mediocre. An estimated $220 billion were spent on mental health services in 2020 within the U.S. Most of that was spent by Medicaid programs. However, reported half of the people aged 18 and older did not receive the needed treatment for mental health disorder. The two most common reasons for not receiving mental health services were due to cost and access. The LGBTQ plus assessment screening includes the DS5, PHQ, MDQ, the SAFE-T, and the CAGE. It is important to note that amongst all age groups, LGBTQ youth ages 11 to 17 report moderate to severe instances for a mental health condition at 86%. Providers should consider all ages for screening of mental health disorder as it is linked to other issues for concern such as substance use, eating disorder, violence, homelessness, and incarceration. There are several assessment and screening tools available for the PCP, with the most recognized being the ones that are listed. The The safety includes 5 steps which address the patient's level of suicide risk and suggest appropriate interventions. And the CAGE questionnaire is a 4-question screening tool that clinicians may use to help in the diagnosis of alcoholism. LGBTQ plus treatment plan includes evidence-based research has shown adapting current practice to include an alternative treatment approach for treatment of mental health issues in the LGBTQ plus. Patients have proven to reduce depression, alcohol use, sexual compulsiveness, and high-risk sexual behavior by normalizing the adverse impact of minority stress, facilitating emotional awareness, regulation, and acceptance, reducing avoidance, empower assertive communication, restrictive minority stress cognition, validating their sexual minority individuals' unique strength, building supportive relationships, affirming health regarding expressions of sexuality. Care plans dependent on patient needs in our PCP setting resources. Medications such as medications as antidepressants, mood stabilizing medication, and antipsychotic medications. The LGBTQ plus patients may require individualized care plans, including psychotherapists, psychiatrists, and or collaborative care with providers who specialize in this population and mental health disorders. Elderly population is defined as people aged 65 years and above. Some of the multifactorial aging changes that make elderly health issues important are diabetes, depression, and hearing loss. Mental illness are shared among the elderly, including dementia, anxiety disorders, and psychosis. Untreated mental illness among the elderly can lead to a poor quality of life and increased mortality. The United States defines the elderly as people being 65 and above. Aging comes with many complexities, and some of these have been reported to cause mental illness among the elderly, hence making mental illness among the elderly a matter of importance. The excess annual adjustment healthcare costs of depression, anxiety, and comorbid depression, anxiety reached $11.9 million per year. Treating older people with mental illnesses require well-coordinated psychological therapy with a well-trained psychiatrist and other medical healthcare professionals in treatment forms to help intervene. The most proper and standardized assessment and screening tools for mental illness among the elderly is the mini mental state examination. A cognitive assessment is an essential tool for screening mental diseases among the elderly and is also used to assess the progression of patients with dementia. The geriatric depression scale is also a necessary tool in assessing and treating mental illness among the elderly. This scale was developed purposely to screen depression among the elderly. This tool has been effective since it can identify the behavioral symptoms of depression. The use of the 4Ds of the psychological assessment tool is also important in treating mental illness. They include cognitive decline, delirium, dementia, and depression. Research asserts that mental illness among the elderly goes untreated since most people assume that mental illness among the elderly is something normal and common among them. Research provides various treatment plans for mental illness among the elderly, for example, using psychotherapy to explore thoughts and feelings among the elderly. Supportive psychotherapists to help the elderly deal with mental illness by building self-esteem among them, improving their social and community performance, which in turn positively affects their lives. Counseling allows the elderly to share their problem in a safe environment since counselors help the elderly deal with negative thoughts and feelings. Creating support groups is another treatment plan for the elderly with mental illness. These support groups allow the elderly to feel less lonely, reduce stress, since they can engage with peers, improve skills to cope with their challenges. Medications such as SSRIs and antidepressants are another option that can be used along with therapy. Migrant workers live outside their countries of origin, making up approximately 4.9% of the labor force of the receiving countries. Despite significant contributions to economic growth, migrant workers are generally excluded from essential service and protective systems in their receiving countries. Migrant workers are at disproportionately higher risk of suffering from poor mental health. Globally, an estimated 281 million migrant workers live outside their countries of origin. Additionally, migrant workers are predominantly employed in labor-intensive manual jobs, commonly referred to as dirty, dangerous, and difficult, and putting them at increased risk of precarious working conditions and occupational hazard. Consequently, they face increased susceptibility to social economic hardship and worsening health outcomes. In particular, migrant workers are disproportionately higher risk of suffering from poor mental health, and several studies have shown that migrant workers experience a greater prevalence of mental health disorder compared to the native population. Despite significant mental health concerns, evidence shows disparities in the use of health service among migrant workers, particularly mental health service. Getting a comprehensive assessment using the RHS 15 is a tool screen for immigrants for emotional distress and mental health. The RHS 15 was developed in a community public health setting to be an efficient and effective way to sensitively detect the range of emotional distress common across immigrant groups. The PHQ-9 is a multi-purpose instrument for screening, diagnosing, monitoring, and measuring the severity of the depression. The PHQ-2 inquires about the frequency of depressed moods over 2 weeks. The DSM-5 is a reference book on mental health and brain-related conditions and disorders. Psychotherapy is the therapeutic treatment of mental illness provided by a trained mental health professional. Psychotherapy explores thoughts, feelings, and behavior and seeks to improve an individual's well-being. Medications such as antidepressant, mood stabilizer medication, antipsychotic medication, and psychotherapy should be used together. Hospitals and residential treatment programs are also treatment plans for immigrants. Supportive groups bring together people who are going through or have gone through similar situations or experiences. A support group provides an opportunity for people to share personal experience, feelings, coping strategies, or first-hand information about diseases or treatments. Sometimes mental illness becomes so severe that you need care in a psychiatric hospital. This is generally recommended when you can't care for yourself properly or when you're in immediate danger or harming yourself or someone else.